Everybody, it's Dr. Pearlman. Welcome back to the channel. I hope I can get this done today in a timely manner. And it has been a busy week, both in the clinic and administratively. And of course, it's that time of the year where it's tax season and many other things happening in my life. One of the first things I just want to say for the people that are local, January. June 7th, there will be a community workout event in Richardson at Even More Fitness with Nicole, myself, and my good friend Kevin, who if you watch any of the podcasts from a couple of years ago, we've done a podcast together about running and the nature of running and injuries. So we, like a dynamic trio, are going to be hosting a Q&A kind of addressing fitness and exercise and health hacks and habits. That morning, we're going to keep it quick. I promise we're not going to bore people to death with talking. That'll be a half of an hour, followed by a community workout, and there'll be some vendors over there, and it'll be a lot fun. It'll be very fun. So one of the things that I haven't talked about, I haven't made a video yet, and I'm going to take the time right now to make this video, is the fact that a lot of you don't know, but I'll get right after it. I fall into the category of someone who is in the space of maybe a failed back surgery. And it's pretty, tough when I say that out loud. It almost feels like, an excuse or something. If you know me and like the way I kind of walk around sometimes, if I'm a little extra tight or in between adjustments or by the end of the evening, I'm a little worn down and I'll kind of walk a little bit slow, a little hunched over from time to time. But the reality is I had an episode where I really hurt my back from a sneeze, and we're going to get into that in a minute, middle of February. And I'm fine now. Here we are, April 8th. So basically all of March to kind of get better, if you will. And, when I say things like I sneezed and my back went out, I hurt my back, I want people to understand something out there. If you bend over to pick up a kid, to pick your child up out of the crib, if you bend forward in the car to reach for something, if you're at home and you're sweeping and then you get up and sit down and your back goes out and you're all messed up in the back and everything is like level 10 pain. We hear all the different stories here in this clinic. As you can imagine, 5 years in solo practice, you hear a lot of stories about how people hurt their back. It is not that event that made you hurt your back. Obviously, what did you do to hurt your back? Your answer is going to be nothing. It's true. You did something very minor. You have to understand the damage that is done that made you that vulnerable in the first place. And that's where I was. I've got a lot of scar tissue on top of these known, what they call annular fissures, which are the micro or macro tears within the lumbar discs of my spine. I thought that by getting the surgery I got a little over a year ago, back in September of 2023, that this was going to decompress my spine, the stenosis or narrowing of my spine, and that the decompression surgery would have been like the end game, in the sense of I wouldn't have my back go out under the circumstances of a sneeze or bending reaching. And I felt all February, and maybe even, to be honest, a little bit in January, that my back started to decline in terms of the stability and sort of the dose response to my chiropractic care. And I started just getting very achy, and then sure enough, middle February, I'm on the couch after a little walk in the morning, I sneezed and it was out. Bad news. If you know me, it's bad news. It's disturbing to see. So what's interesting was, at that point I made up my mind I have to try a different realm of chiropractic, because whatever I had done had reached a diminishing return. And if you're a patient of mine, and this is very important, we educate our patients, especially people that have been in a lot of pain for a long time, about the principle of diminishing return. And it's just that, it's a principle. You're sort of saying, why wasn't that adjustment to my lower back or my neck or wherever as powerful as it was the first time? It wore off faster. It didn't hold, as chiropractors like to say. It really is the inability of that chiropractor, who let's say you like and you get a good result and your back's in less pain, and it's not a knock on them, but it is the accountability. See, the accountability goes to the chiropractor at that moment in time, because they didn't manage your care with what I call combinations and patterns of adjusting to keep you stable. And I had pretty much plateaued in the way I was responding to the care I was getting. Now, is that my fault? Is it their fault? Is it everyone's fault? I go to a few different chiropractors for a few different things. I think everybody is accountable, but look, if I'm not seeing somebody on the regular with x-rays and letting them manage me and getting a certain result and keeping that stability, then a lot of it is on me as the patient not communicating as thoroughly as I need to. All that being said, I found a different technique that's worked very well for me. It's a positive y-axis traction. You can find that stuff out there on YouTube. It is what it is. As we know that there's moves that I will do that are similar to replicate that in this clinic, and I know that my patients have gotten great results. Thus, I went out and sought that because I can't tell you that I tried everything. No, I actually went and got surgery, and I never even tried that technique that way before prior to surgery. And I will say that with two treatments of that positive y-axis traction technique, I was working full shifts, 3 days after this really bad relapse in my back pain. And then after that, everything takes time, everything will heal in time. And it took about a month for me to really start to feel stable again. And one of the take homes is, number one, again, you want to avoid the diminished return, principle of diminished return. You want to avoid that. And how do you do it? You have a chiropractor that knows how to manage a case. A long time ago, I had a mentor, and a lot of what he said, here I am 5 years later, I don't think a lot of it is true. But I do think certain things they told me are very true. And one of them was that when you are a chiropractor, it's going to come down to two things. Your skill as a chiropractor, aka delivering the care and being right and them getting a result, right? So if you're not getting a result and a positive outcome for that person, things are going to go, south, right? It's not going to work out for you as a chiropractor. You got to have the skill. But then more important about that is managing their case. As students, a lot of the time, chiro students, if you're listening to this, or young chiropractors fresh out of school, if you're listening to this, you might think that, case management is some kind of thing we say, but it is incredibly true and it is incredibly important. And I would say the top two things as a chiropractor, outside of mindset and confidence and understanding like what it is you're doing in communication, because those things are important to communicate to patients, and building a practice and having sustainability. What I can tell you is the most important two things is having the skill. Have the mother effing skill as a chiropractor to be able to palpate, evaluate, understand where people are coming from, connect with them, and then deliver the adjustment and them feeling the difference. I mean, if they don't feel the difference, if they don't go and tell people, how are you going to build a practice? How are you going to get people better? How are you going to have them come back? And then when they come back, it's understanding that combinations and patterns, avoiding diminished return, and understanding how to work around these things with these people, because they need to know and they need to feel that you are doing what's best by them. Because in conclusion to this video, me and my back getting stable over the course of the last 6 weeks, or me and my journey through my own back pain, and I've seen many of you out there, and I hope a lot of you watching this understand or can see through the camera how sincere I'm being, because I just want to open up and say no, my back is not great, but it's getting better, and I am learning to do things where I finally, even after surgery now, I'm just saying, okay, I won't do the reverse hyper anymore. I probably won't do back squats anymore. When I do deadlifts, it'll only be hex bar deadlifts, things of that nature. I have to minimize how many pull-ups I do, which is a whole other conversation about thoracolumbar overbracing. Bet you didn't think that was going to come out of my mouth. But that is a real conversation that you need to have with lower back or back pain suffering patients. And, through my experience, I can communicate with you open and honestly and tell you that you have to have chiropractic competence. That's right, competence and management in order for these things to get better, stay better, and avoid things like surgery. Now, I have had this, I do want to say one last thing. Excuse me, I said one last thing, or in closing. In conclusion here now, officially, people will say things like, I just want to get one and done. I had a guy a long time ago say, I'm going to get one and done. That was 10 years ago. He's back in surgery right now for another nerve root rhizotomy kind of deal, or nerve block. Who the hell knows what he's doing? Doesn't like chiropractors, doesn't trust us, whatever. I get it. Look, I understand. I see where it comes from. But think of how ridiculous this is. People think they have to go to the chiropractor all the time, or chiropractors want people to keep coming back. Like I just told you, chiropractors, right? Us chiropractors, we manage people's spines. We manage their spinal joints. We actually manage their nervous system. we won't go that far to now, but I don't want to diminish what it is that I do on a daily basis to some people's, nervous system tone when it comes to adjusting their spines and keeping them out of pain, keeping their symptoms minimized under wraps. And so what it is when we're doing these types of things, this is a commitment like taking your car to the mechanic. I mean, really, that's what we are. We're mechanics to people's vehicles, their bodies, their engines. This stuff matters. And you are making a commitment to that over time. An average chiropractic care plan, forget even what I think it is out there, if it was like $1,600 for the year, whatever, average is $50 a visit, whatever it is on a frequency, like in my office, the average care plan is $600. Literally, like the average patient pays on average $600 for the year. For the year, that's the average patient. That's very little. When you go by other chiropractors that I know, $600 for the year. Are there some that pay $1,200, $1,800? Sure. Are there people that pay, $400 or $500? Of course. It all just depends on like what they are coming in for and what their needs are. And that's just it. When you're paying for your surgery, your one and done, that is, first off, not guaranteed. Oh, by the way, did I mention it's invasive? They actually cut you open and go into your spine. And a lot of bad things can happen, whether the hardware's going in and screw placement, anchors, clips, scarring, scar tissue from your muscles getting cut open. We're just throwing that out there. Again, it's necessary some of the time, but don't think it's one and done. And did we talk about the deductibles between $3,000, $6,000, $8,000 deductibles? Mine was almost $8,000 on top of the additional premiums that I had to pay back when I was through United, paying into this, so that one day, God forbid, that I needed surgery. I mean, so chiropractors are overcharging if the tune of what, $600 to $1,200 to $1,800 a year. And if people complain, even if you're paying your premium of $350, $400, $500, $600 every month for your Blue Cross or United, whatever it is, you're still going to pay your between again $3,000 to $8,000 deductibles, let alone whatever costs that they don't pick up. So again, please guys, don't say you've done everything if you haven't done everything. Understand that real healing takes time, and that on that same notion, chiropractors have your best interests at heart. And if you find one that doesn't, go to another one. Because if I didn't go to as many chiropractors if I've gone to, with my back pain through the years, I mean, I just flat out wouldn't be here. And, it's worked out really well because I have I've been realizing what it's like when you're mismanaged, what it's like when you need to switch it up, what it's like when you say you've done everything, but you haven't done everything, and how to like live this life of I'm going to be performing at the highest level I possibly can for as long as I possibly can, knowing that it's going to take lower back pain or neck or pain management, not through steroids, not through shots, injections is what I meant to say, not through a lot of pharmacological, help with, NSAIDs, or God forbid someone gives you something like an opioid. I mean, guys, no. You can do this naturally through good old-fashioned clean eating, exercise, mixed in with good old-fashioned, since 1895, chiropractic. And I hope that this message found you well, and I hope you stay well. Reach out anytime, anything you need. I've got to get back to work. And until next time, this is Dr. Pearlman.